Good afternoon, guys. Now, discussion C deals with in home dementia care, meaning care comes to the client in their own home. Okay, so we're going to discuss that for C. So please join me for today's discussion C in home dementia care. Um, so we'll start now. Consult a qualified healthcare professional or geriatric care manager to match care choices to the senior's medical needs, safety risks, and family capacity. The article on your active tab highlights that more families are choosing in home dementia care so seniors can remain independent. It frames a village caregiving guide that outlines the top at home options and emphasizes that home caregivers can boost comfort, mood, and safety. Common in home care options. What the page is pointing to: family caregiving, unpaid care from relatives, often the first line of support, and can be combined with paid services. Home health aides and personal care attendants trained to help with bathing, dressing, toileting, meal prep, and basic mobility. Skilled home health services, licensed nurses or therapists who visit for medical needs, wound care, medication management, physical therapy. Companion care and dementia trained caregivers focus on supervision, social engagement, and behavior aware support to reduce agitation and isolation. Respite care, short term in home help so family caregivers can rest or handle other responsibilities. Adult day programs and community services, daytime supervision and activities that provide structure and give families daytime relief while keeping the person engaged. Telehealth and remote monitoring, virtual check-ins, and seniors are sensors to track safety and health changes when in-person visits are limited. How to choose between options: match level match level of need to skill level. Medical issues require skilled nursing. Daily living help can come from aides or companions. Prioritize safety and routine. Dementia care benefits from predictable schedules, environmental modifications, and caregiver trained in de-escalation, balance independence and supervision. Choose the least restrictive option that still prevents falls, wandering, or medication errors. Consider caregiver support. Use respite care and community programs to avoid family burnouts. Practical considerations and next steps. Cost and coverage. Check Medicare, Medicaid rules, long-term care insurance, and local programs. Cost vary by service, type, and region. Training and background checks. Verified caregiver training in dementia care and request references or agency credentials. Home safety audit. Assess fall risks. Install locks or wander prevention measures. And simplify the environment. Create a care plan. Document routines, medications, emergency contacts, and behavior triggers so all caregivers follow the same approach. Key takeaway in home dementia care can combine family support, trained caregivers, skilled medical visits, and community programs to preserve independence while improving safety and mood. Okay, now we're getting into the second half of presentation C. So here we go. Consult a qualified healthcare professional or geriatric care manager for personalized medical or care decisions before acting on the information below. What that line of text is on the page. The string you quoted is a site navigation or topic index from the National Institute on Aging. It lists the main subject areas the National Institute on Aging covers and links readers to focused resources. For example, pages about Alzheimer's and dementia, brain health, guidance, caregiving help, clinical trials, exercise and nutrition advice, downloadable publications, and a dedicated page about services that help older adults remain at home. These headings organize content so families and professionals can quickly find practical information about or information in local resources. Okay. Here's part of section 2. What each item points to and why it matters. Alzheimer's and dementia. And in-depth information on symptoms, progression, diagnosis, and care strategies for Alzheimer's and related dementias. Useful for understanding what to expect and planning care. Brain health, uh, prevention and risk reduction, guidance, cognitive stimulation, vascular risk control, lifestyle factors aimed at preserving thinking and memory. Caregiving, practical tips, safety checklists, and emotional support resources for family and paid caregivers, including how to find help and avoid burnout. Clinical trials and studies, information on research, opportunities, how trials work, and how to find studies for treatments or prevention. Important for families considering experimental options. Exercise and physical activity. Evidence-based recommendations on physical activity that supports mobility, mood, and brain health for older adults. Healthy eating, nutrition guidance tailored to older adults' needs, weight, chronic disease management, swallowing issues, and practical meal planning tips. Download publications. Ready to print guides, checklists, and fact sheets families can save or share with care teams. Services for older adults at living at home. A hub describing in-home supports, home health, personal care aids, respite care, adult daycare programs, transportation, local service, local resources locators, and how to find them. Okay, here's another part, guys. How the services for older adults living at home page connects to other topics. The services page translates the general guidance from the other topic pages into actionable local supports. For example, exercise and healthy eating advice can be implemented through home health visits or adult day programs. Caregiving guidance pairs with respite and training resources, clinical trials, listing may be relevant for people with Alzheimer's. The National Institute on Aging frames these topics so readers move from learning what dementia is, how to support the brain health, how to support brain health, to practical steps, who can help at home, where to find services. Okay, so next page. Quick practical next steps based on the page. Use the Elder Care Locator or the National Institute on Aging service links to find local in-home help and transportation. Okay, then you have downloaded relevant PDFs, care plans, safety checklists to share with families and clinicians. If caring for someone with dementia, review caregiver resources and safety tips, wandering prevention behavior strategies, and consider joining a support group. Key takeaway. These headings are a navigational roadmap on the NIA sites that link evidence-based information, brain health, exercise, nutrition, research to practical supports and local services that help older adults remain safely at home. Okay, guys. So that is your C. I will be back on later with D in a bit. So I will see everybody for D in a bit. For now, Gator Wellness. Take care, folks.